From sunny St Leonard's on the south coast of the UK, this is the Keto Woman Podcast, brought to you by me, Daisy Brackenhall. Hello Keto Lovelies, and welcome to episode number 228, where I'm joined by Megan Pfeffer for another Bitesize Nutrition episode. Now, I think I teased you a little bit, just like she teased me, saying that she was going to be talking about a bit of a controversial topic. And it's controversial in the way that it's something that is so often recommended, supplementation-wise. But I'm not going to tell you anymore. I'm going to let you find out. And I'm not going to give the game away with the title either. Well, I might give the game away, but I'm going to call this episode Bone Health. You might straight away know what we're going to talk about, but I thought I would let you find out along with me as we go. I certainly found it really, really interesting and learnt a lot, as I always do when I'm talking to Megan. So thanks very much to Megan for coming back for another one of these bite-sized nutrition episodes. It's been way too long, she reminded me. We haven't done one of these episodes yet this year. This is the first one of the year, so it's been way, way too long. We'll have to get her on more often, as long as she's got time, of course. And you can hear more from Megan with her previous Bite-Size Nutrition episodes, but also when she shared her story in her own episode. And I can't remember the numbers. I will put links in the show notes so that you can find them easily. Quick roundup, and I am going to try and keep it quick. I've got lots to do, so try and keep the editing as quick as possible. It's been a little bit of an up and down week. I've been struggling a bit to get up in the mornings. I guess just because I've had quite a lot to do, and I've got back into watching a bit of TV in the evenings. I've been having a few later nights than usual, so it's been a bit of a struggle to get up in the morning. Also been feeling not exactly down, but not exactly up either. So it's just been that bit more of a struggle. Miserable weather. It's been cold and wet, and I know the sea's been a little bit rough. And we've had a few pollution warnings, bloody southern water. Won't start ranting too much about that, but there's another disgusting leak just up the coast. Never mind the overflow, the outlets. They chuck whatever nastiness they do into the sea every time it rains, it seems. Bastards. You will know if you know me. I am not a fan of southern water. It's all about the shareholders, and we will leave it there. Shame they can't spend the money on their customers and keeping the sea nice and clean. But I really will leave it there now. What else? So I have been struggling a bit. Haven't been down to the sea that much this week. The weather does look like it's going to be nice this weekend. So hopefully, as long as there's not too much sewage in the sea, I will try and get into the sea this weekend, hopefully with some sunshine. The dogs are all fine. Rocket has been a little bit on fly alert, but he's very much liking, as well as the other dogs and the cats, the new fluffy anti-anxiety beds. They've all gone down very, very well. I don't know if you've seen those. If you're anything like me, you've been caught by Facebook ads. That's exactly how I saw them. I thought they looked really, really lovely. And I do remember also actually seeing Terry's dogs all nice and cozy in very similar beds. And she said that Gracie especially really likes them. So I thought mine would enjoy them, and they do. All of them. Like I say, all of them do. Actually, the only one who doesn't is Mimi, one of the cats. But Belle, the other one, she particularly likes to position herself right in the middle of the large fluffy bed, which upsets Rocket greatly because he won't get in if she's in there already. The builder was due to have started by now, of course. And of course, he hasn't, and he needs chasing because I haven't heard from him. So nothing to report there either. I have finally been implementing a fasting regime. It's something that I've really been wanting to establish, a regular fasting regime. And finally, all the editing I've been doing, it's been trickling down from the fasting method, the podcasts and the videos. And I think it's just been seeping in. It's been coming at me from enough directions that I've finally bitten the bullet and have been fasting for probably at least 2 or 3 weeks now, actually. And not that I haven't dabbled before, but I really wanted to set up something that Megan says all the time as being important is consistency. And consistent is definitely not something I've been in the past. So that's something I've been trying to do. And it was Nadia who was talking, well, they both talk about building the fasting muscle, but Nadia was talking about taking it in steps. And she spoke about starting with no snacking and then maybe some fat fasting, maybe alternating 1 meal, 2 meal, stepping it up. You get the idea. But you know me, I have to come up with my own plan of attack because there's always something about a set plan that I push back against. And something that I have always found really, really difficult is one of Megan's number one, if not the number one rule, no snacking. Kind of easy first step, right? No, not for me. Really, really struggled. I've wanted to be a non-snacker for decades. You have heard Terry and I talking about making it part of your identity. Well, I've wanted this to be really, really hard-baked, embedded there in my identity. I am not a snacker. I am someone who just eats at meal times. I do not snack. Yeah, easier said than done. So, you know what? I decided to set my own steps. And something that I find easier is not to eat for a particular length of time. Now, I have struggled with the slightly longer fast, fasting overnight, but what I knew I would be able to do relatively easily, and I had Kim's voice in my head as well, talking about learning to trust yourself again, getting some easy wins under your belt. And so I thought, okay, what's my first step? What do I know that I can do that's going to be a bit of a stretch? It is going to be a challenge. It's not going to be easy, but it's going to be relatively easy to achieve. And that, I decided, was to alternate 1 meal, 2 meal during the week. So Monday, Wednesday, Fridays, I have 1 meal a day in the evening. Tuesdays, Thursdays, weekends, my usual 2 meals a day. But the other rule, or I guess non-rule, that I imposed was that once the eating window opens until it closes, I'm not going to enforce no snacking. If you want to snack, you can. Go for it. But on those 1 meal a day days, so Monday, Wednesday, Friday, you do not eat. So therefore, you cannot snack until you get to that meal. And then that eating window actually is not that long because it's not that long until bedtime. And I know that if I eat too close to bedtime, I really don't feel very good, don't sleep very well. Not to say I don't do it sometimes, but I've learnt to try and get around that. So that was my rule. 1 meal a day, Monday, Wednesday, Friday, 2 meals the other days, and snacking not off the table. And true to my predictions, it has been a challenge from, I would say, pretty early in the afternoon through till probably 5 o'clock. Sometimes I want to chew my hands off, but I've done it. As I said at the start, it's been a stretch, but it's felt achievable. Funnily enough, once I go past that point, I often then forget and get, I'm busy with work or whatever, and I suddenly realised, oh no, it's like 7 o'clock, I need to eat. But that's what I've been doing. And guess what? Funnily enough, I have hardly been snacking. I'm not saying I never have, because that would be a fib. But for the most part, something in my brain has said, hey, look, you went all day yesterday. You didn't eat till about 7 o'clock. You'd basically gone pretty much 24 hours without eating. You managed that, and it was challenging, but you did it. It's only a few hours till your next meal. So why don't we just wait? Another little voice in my brain is saying, it spoils that meal a bit. It's actually nice to properly get hungry for your meal and enjoy it. That thing you're thinking of snacking on. And let's face it, it's always something like some nut butter or some cheese or some dark chocolate, whatever it is. Those are the things that I'm reaching for. Let's just wait and enjoy them as dessert. And for the most part, 95% of the time, that's what I've been doing. So sometimes you have to set your own steps that work for you, and sometimes just sort of by sneaking around, coming at it from a different direction, you can actually achieve something else that you've been wanting to do for a long time that kind of would have been that logical first step, but for some reason just seems so difficult, a rule or a new habit to impose. So I can't yet confidently say I am not a snacker. I only eat at meal times, but I can confidently say I'm a long way towards getting there. So I'm feeling pretty pleased about that, I have to say. And I'm recording this on Thursday evening, so tomorrow is my last one meal a day fasting day of the week. And then we go into the weekends. And I usually find something a bit sort of extra tasty for the weekends. And basically, I'm going to do that. And this is where it comes back to the discussions that Megan and Nadia have had lots of times, that's finally sunk in, about building that fasting muscle. And they relate it to building muscles at the gym. You always want to push yourself a bit, but not so hard that you feel awful. You want to feel a little bit sore. You want it to be a little bit challenging, and you do it until it starts feeling easy and it feels like, you know how to do this, and you get ready to take the next step and you want to stretch yourself a little bit more. So that next step for me will be turning that one meal in the evening to something a bit lighter, and then the next step, it might be just having a bit of bone broth or some miso soup or something like that. And then, before you know it, probably it's going to be weeks, maybe months down the line, I'll skip that evening meal altogether. That's the plan. That's what I'm heading for. My goal is to be doing 3 42s or a couple of 42s and a 24 a week, something like that. That's my goal. That's the consistent fasting practice that I've wanted to put in place for a while. But that's the other key, see, patience. I'm being patient about it and building that consistency. So that's what I've been doing. And as you can see, all my editing work has started to infiltrate and have an impact on me, which is great, isn't it? Good side effect. And having said I was going to keep it brief, I have been rambling on. So I will leave it there, and I will leave you with Megan Pfeffer and this Bitesize Nutrition episode, where we are talking all about optimizing your bone health and how very, very far-reaching, varied a topic it is, and how very important it is, of course. So I hope you enjoy it, and I'll see you on the other side. Welcome back, Megan, to the Keto Woman podcast. We're back for another Bitesize Nutrition episode. How are you doing today?
Hi, Daisy. I'm doing really well, thank you. It's so nice to see you. It's been since late last year. Really good to see you. How are you going?
Yes, I was trying to remember. It's been a while. Yes, I'm very good, thank you. I was just telling you before we started, and I keep peering. No, it's definitely stopped snowing. It was snowing a lot before we hit the record button, and I was kind of looking forward to going and having a swim in the snow, but unfortunately it seems to have stopped. They were those nice big fat flakes, and I thought, oh, exciting.
Yeah, so beautiful.
I'm not sure that would be everybody's first thought, that they would want to go swimming in the snow.
No, but beautiful to look at. I would love to see it, but definitely not thinking I would love to swim in it.
Just another type of swim, I thought it would be fun, but maybe it will start snowing again. But it's not really the right time of year to be snowing. I didn't believe, somebody in the park told me it was going to be snowing at the end of the week, and I didn't believe them. Well, they were right.
Incredible, and because you had such sunshine and beautiful weather earlier in the week, didn't you? So that's
I know,
quite a contrast.
crazy. Yeah, that's the UK for you. I remember it snowing long time ago, and I know Easter varies about, what time of year it is, but I know it was a late Easter, so the latest Easter it can be, I think, whenever that is, sort of mid towards the end of April. I know it was a late Easter because I can remember my mother commenting, and it was the Easter school holidays, and we'd gone to London Zoo for a day trip. And it snowed. So it often does. I think it's even snowed in June in the UK, but obviously that's very, very unusual. But yeah, we can get these snow flurries later in the year. It's quite exciting. I do kind of miss, it was many, many years in France, the last sort of block of time that I lived there, I hardly saw any snow. But when I first moved there, we would have a reliable, heavy snowfall once over the winter. And it could be any time. Sometimes it would be in December, sometimes it would be in March. But we'd have that reliable, foot thick snowfall that would be there for a couple of days, which is always kind of fun, and the dogs loved it, and it was everything looked beautiful. I used to sort of love it to come and go within a couple of days, because of course then it just starts getting annoying, doesn't it? But it's good fun.
And while it's white and pristine.
Exactly. But whatever it is, climate change or whatever the reasons are, at least 5 or 6 years in France, no more than a smattering. I think, of course, they did have some snow this year when I left, but still, not very much, not more than, a few centimetres. But yes, typical Brit talking about the weather, but, it's quite exciting. Like you say, when we've had, temperatures, it was like 16 degrees and sunny, everyone in shorts and T-shirts.
Yes, only days ago.
A week ago. And all of a sudden, it's snowing. But yeah, it's that old Crowded House song, isn't it? 4 seasons in one day.
Yes, yes, exactly.
Anyway, back to what we're supposed to be talking about. You teased me with saying you were going to be talking about quite a controversial topic. So I'm super excited to find out what you're going to be telling me about today.
So today I'm going to talk about a relatively new approach to bone health that ditches the concept that calcium supplements save you from osteopenia and osteoporosis. So I'll be talking about the best approach for healthy bones that won't increase your risk of heart disease and increase joint pain as calcium supplements can. And I've got some great info about that.
Oh, interesting. That is actually talking to something that I got very interested in a while ago. And I think I even had the test. Is it the PTH? It's the parathyroid hormone. Yes. So actually, yes, I do know a little bit about this.
Good. Okay.
I'm very excited.
Yes, and I do remember you commenting on it before, and I was impressed with your knowledge. So it'll be an interesting conversation.
Because it is always that first thing people think.
Absolutely.
Calcium. But yes, I did dig into this a while ago. So yeah, very interesting.
Good.
Okay, go for it.
All right. Well, so calcium is often considered the quintessential nutrient for bone health. It's often the only nutrient that's discussed when it comes to protecting your bones. Although nowadays vitamin D3 is often mentioned, which helps to absorb calcium. And if you're really lucky, you'll hear about vitamin K2, which we'll talk a little bit more about later. But the bottom line is that calcium supplements are overprescribed. And today I really want to talk about what you actually can do to protect the health of your bones, to prevent, slow, or even potentially reverse osteopenia and osteoporosis, and why calcium supplements aren't the answer, and they can in fact cause harm. So firstly, we need a really brief overview of what bones are actually made of in order to understand why they can fracture more easily as you age, and to move away from the mentality of a one supplement pill will fix everything, and instead move towards a more comprehensive understanding of the full spectrum of nutrients and lifestyle factors that are required for optimal bone health.
Because it is a big worry, isn't it? And
It is.
It is something, especially for postmenopausal women.
It really is.
Estrogen declines, it really does impact. It was one of the things I was thinking about actually when I was debating whether to take HRT or not.
Yes. So it really is something that affects us all, and it's something that we need to consider. Not only just once you're postmenopausal, you really need to be considering this earlier.
Right.
So just a little bit on the history of bones to really kind of understand this concept is that bones are organs that are responsible for far more than simply just transporting us and protecting our vital, internal organs and maintaining mineral balance. The skeletal system is also an endocrine organ because it releases the hormone calcitonin that can affect things like pancreatic beta cell function, which produces insulin, glucose metabolism and energy expenditure. Bones can influence cognitive functions, and they exchange minerals with the blood and extracellular fluids. So we usually think of bones as being hard, lifeless objects, but they are actually living things and they're forever changing. In fact, they're totally renewed over a 7 to 10 year period.
Wow.
And we really have no idea that bones are involved in energy metabolism. It's not something that we attribute. And more research is finding more and more just how vital they are in those processes. So the bones have specialised cells that are constantly in a process of breaking down bone that is stressed and damaged and creating new bone to replace it. And when the rate of dissolving bone outpaces the rate of creating new bone, then bone loss results. And this usually starts to happen in around your 40s, but it can happen earlier, especially for women who undergo premature or early menopause. Dr. Avram Blooming points out in his book on estrogen, which I've borrowed quite heavily from for this discussion today, and I provided some links for it in the show notes,
right.
There is a crucial difference between bone density and bone resilience or strength. So we're typically taught to focus on bone density because that offers the silver bullet of a quick calcium supplement fix, and it's also what medical technology can scan for with the Dexa Scan.
Right, yeah.
But you can actually have good bone mineralisation and still be at higher risk of fractures, and diabetes is a good example of that.
Interesting.
So there are really two main parts that make up the bones, and bones are made of both protein and minerals. So bones have this internal structure with an external framework. So the internal area is made from flexible collagen fibres, which are proteins, and they provide the structural support and the elasticity and, importantly, bone resilience, or what we call tensile strength, which measures how much force is required to bend a bone to breaking point. So the internal area of the bone, called the spongy bone, allows the bone to undergo stress and to bend without breaking, obviously to a point, but it means that if you were to have a fall, you have less chance of fracturing your bones if you have good resilience or tensile strength.
Oh, that's interesting. So then presumably brittle bone disease, that's where the main issue lies, is it?
Yeah, so it's kind of changing our focus from what we're typically taught to believe, that low calcium means brittle bones. So, and as you age, of course, and particularly when estrogen levels are low, these thick elastic collagen fibres become thinner and more brittle, and this increases your risk of fractures. The next important part of the bone is that outer shell, which is made of the calcium phosphate, which deposits onto the spongy bone. And that's what provides that strong protective barrier for the spongy bone. It provides supportive strength to bones, but importantly, it doesn't assist with the bone's ability to bend without breaking. And this really is the key concept, and that's what really, drew my interest into this topic, because so many of us don't really understand that. An increase in calcium and other minerals increases the stiffness and supportive strength of the bone, but it can decrease its flexibility. If you're taking a lot of calcium supplements and just adding on to that factor, you can be reducing the bone's flexibility.
So that's where the potential negative factor comes in.
Yeah. And here's another really interesting detail, that according to Dr. Blooming, there is a difference between osteoporosis, which means compromised bone resilience in that spongy bone matrix. to osteomalacia, which means a deficiency in bone minerals such as calcium and phosphorus. We don't hear those two states being talked about separately, and Dr. Blooming suggests that the blurring of these two conditions means that we now incorrectly believe that simply getting enough calcium and vitamin D will protect against osteoporosis. So even though calcium is critical for developing bones in children and adolescents, additional calcium beyond this point doesn't necessarily prevent or treat bone loss. And while we do still need calcium in our diets, because it's used for more than just our bones, it's used to regulate heart rate and nerve transmission. For example, low intake will encourage bone breakdown to release calcium into the bloodstream, whereas that's where you get that parathyroid hormone that will signal that the bones need to release more calcium if you're not getting enough through your diet.
Yes, that's what I found really interesting when I read about that it's useless testing the serum calcium levels,
yes,
because your body will always maintain. It's one of those things that you have to have a certain amount of calcium in your blood. So it will always be there. But what you want to find out is where your body is getting that calcium from.
That's
and
right.
Having the parathyroid hormone test tells you whether your body is drawing that from your bones, which obviously you don't want it to do, or whether it's getting it from other places. So a calcium test is useless, but parathyroid test that's the master.
Correct. The master regulator.
Yes, that's the word I was looking for.
That's right.
Which
yes.
will tell you better what's going on. Because I can remember telling a friend of mine, the other thing that came up was she had very low vitamin D. And so it's like, I saw something very different in her test than her GP did, who was telling her to take, guess what?
Exactly. Calcium, the good old calcium supplement.
Yeah.
Yeah, and so,
Fascinating.
with that, so the low intake will encourage that bone breakdown to release the calcium into the bloodstream, but supplemented calcium isn't going to be helpful for postmenopausal osteoporosis, which is caused by low estrogen. And usually also things like decreased exercise and other lifestyle and dietary things that can help to support bone health, which we will talk through a little bit later. And so it's not the calcium and other minerals that's causing that postmenopausal osteoporosis, it's the decline in estrogen. And Dr. Blooming quotes a meta-analysis actually that looked at 33 different studies that included over 50,000 people, comparing rates of bone fractures in people taking supplements versus placebo or no treatment. So they found no association between calcium on its own, vitamin D on its own, or calcium plus vitamin D in fractures. And I just find that, to be mind-blowing, considering that that is the standard prescription that you'll get if you've been, deemed that you have poor bone health. So calcium supplements may show, some improvement in bone density, but not in the bone resilience. And that's because it's the compromised resilience to stress provided by that spongy bone inside that I described, which is made of collagen, and that's what's contributing to those stress fractures. And estrogen and progesterone stimulate bone formation and protect against bone loss, and studies do show that estrogen replacement therapy and hormone replacement therapy for a minimum of 10 years do prevent osteoporotic fractures in postmenopausal women. However, the protective effect is voided after 6 years of stopping hormone replacement therapy. So I think that's really interesting too, and that's got some interesting aspects to it, because it shows that you need to be on hormone replacement therapy for a relatively long time to get the protection for your bone health. Now, a lot of women aren't on hormone replacement therapy for a long time because there have been studies that link it to cancers and other conditions. So, looking into a lot of the research though, and this book, and I've linked it here because it's so great to have a read into this topic. It's so interesting. And you really do need to, I think, to look into it further, because so many women have, postmenopausal symptoms that are really compromising their quality of life and potentially also compromising their bone health, because they're being told that long-term hormonal replacement therapy can be dangerous. And there are studies that actually show that really there is no higher increased risk of breast cancer in people who are taking hormone replacement therapy to those who aren't. And in fact, some studies actually show there's an increased breast cancer for women who aren't taking hormonal replacement therapy. So that's something to research and talk to your medical team about. But I just find that's really interesting that you also lose that protective quality of just taking the hormonal therapy if you stop it after 6 years.
Yes, it's very interesting. And those were the two factors when I was deciding, because I thought, oh, I'm too late, because I knew I'd sort of gone through menopause, and I sort of thought, oh, you're supposed to take it during the change, and maybe it's too late, but they prescribed it to me. But the two big factors that swung my decision was, yes, the bone, and it was with your estrogen falling off, impacting bone health and also the mental health, the increase in things like Alzheimer's associated with lack of estrogen. So it were those two things that outweighed pretty much anything else. Because there was a question, the other question, we should do another episode on this, but there was a question with, I didn't know how it would impact the lipidemia, because I know anything that throws hormones a bit out of whack and make that a bit more aggressive. So there were different things that I had to factor in, and to be honest, the breast cancer, I'd pretty well ruled that one out along the lines of what you were just saying. But yes, those were the two big things, and yes, bone health was a big one.
Yeah, absolutely. And I mean, there are other things to take into consideration, and some people will consider bioidentical hormones as opposed to hormone replacement therapy, and that will include things like, predisposition to blood clotting, and, various things like that can be affected. Also, you do need to start hormone replacement therapy within a certain amount of time post-menopause. Otherwise, there can be implications with heart disease and so forth. So there can be kind of a window, I think, of where you need to start that. So you really need to talk to a medical professional about that if you're considering perhaps taking that. And that can depend on, again, what your risk factors are for cardiovascular disease and those types of things as well. But for people who haven't gone through menopause yet or are in the transition of going through that, I think it's really worth exploring that and arming yourself with the knowledge.
Absolutely.
Again, being your own health advocate to look into that so that you can talk to your medical professionals about it. Interestingly, though, the Dexa Scan is considered the gold standard to diagnose osteoporosis by analysing the mineral component of bone tissue. Around 50% of postmenopausal women with a fracture incident have bone mineral density levels above what the World Health Organization criteria is for osteoporosis. So I find that really interesting as well, that a lot of women are getting a Dexa scan thinking their bone health is fine, which to me can really do more harm than good, because you're then not considering that you have to take other precautions to protect your bone health. So you're not getting that full story, and you're falsely relying on something that isn't giving you the whole picture.
So what's the issue with the scan? Does it focus more on this outer shell than tell you what's going on in the inside? Is that the problem?
Yeah, because it's looking at the bone mineral. So that outer shell, the calcium deposits is the mineral content, but it's not looking at the collagen side of things that shows that bone resilience or the bone strength. There was a study by Patrick Garnero in 2012 who stated that bone fragility, also depends on the structure, the shape and the architecture of the bone, in addition to the parts of the bone matrix like collagen that can't be readily assessed like you can with the Dexa scan. So meaning that we're better to know about the lifestyle and diet factors that can affect bone health and make the changes we're able to, rather than just relying on Dexa scan to tell us whether our bones are okay or not. The other interesting thing I think around this is diabetics, for example, have an increased risk of bone fracture that is higher than what you would expect, because often they have normal to high bone mineral density tests. Now, that could be through factors such as the fact that they're carrying a lot of extra weight, could be improving their bone density because you're, that weight bearing type, having that extra weight, building resistance against that. Anything that poses that stress on the bones is really instructing the bones to produce more dense bones to be able to take that weight load. And so that could be affecting that. Often diabetics also have low vitamin D, but importantly, that high blood sugar deteriorates collagen in bones and cartilage. And I think, for keto women already doing keto will be relieved to know that lowering those blood sugars is also protecting your bone health. And that's, a really major thing that people can do to help improve the integrity of their bones and their cartilage, for people who have osteoarthritis and those types of things as well. But also the advanced glycated end products, or what we call AGEs, can actually, in people with high blood sugars, but also people who eat a lot of barbecued meats where you're really caramelizing and browning the proteins, because it's that caramelizing, it's the reduction of the sugars and the proteins together that causes these age products.
Interesting.
Yeah, and those age products are thought to contribute a lot to the degradation of bone health as well. So I will often recommend to people to not just have barbecued and grilled and browned meats, to have slow cooked meats as well, which again is important because then you tend to get the other cuts of meat that contain tendons and all of the other things that have more collagen in there. So, it's good for many reasons. Another consideration is people who have had bariatric surgery. They often have higher bone density to begin with, likely again due to the increased load on the bones from excess weight. But there was a study by Yu et al. In 2015 which showed deleterious changes in bone in patients that had occurred even though their average blood levels of calcium, vitamin D and parathyroid hormone had been maintained within the normal range. So that's really interesting because typically insufficient calcium and or insufficient vitamin D would result in that increased PTH, which are the key mechanisms through what bone loss is typically regulated. So this type of outcome in the study shows that there are other regulatory functions that are disrupting that bone loss for people after bariatric surgery who are typically prescribed 3 times the amount of the daily calcium intake in supplements because they're told they're not going to absorb calcium well after bariatric surgery. So they're given high dose supplements, and I think that can be problematic for people as well.
Yes, I was going to ask you what is the reasoning behind that? So it could potentially be high supplementation.
Yes, if you've got that malabsorption, but you do actually absorb calcium along the entire intestinal tract. So you absorb more of it in that small intestine, and people who have had, depending on what type of bariatric surgery, but you obviously don't get a chance to absorb it as much in there. Sometimes mostly due to, depending on what type you've had, but sometimes due to the reduced acid that you're producing. People with gastric bypass often don't produce as much acid. And acid is required to absorb calcium and other minerals, and other nutrients. So that can be an issue there as well. It's a little bit more complicated for people who have had bariatric surgery. But again, adding those supplements to there, particularly if it's going to other areas, if you take more than 500 milligrams of a calcium supplement, for example, it can't be absorbed. Right. So, you're going to space them out, and it's often recommended that people space them out. But again, how much can you absorb in a day, and how much are you absorbing, and how much of that is then actually going to perhaps depositing in the soft tissues as opposed to going to the bones, particularly if you're not, getting a diet with good levels of vitamin K, which are unlikely to because you can only have very small amounts of food. So it's a really complex relationship if you've had bariatric surgery in relation to all of the nutrients, because of course calcium, what they say is that you absorb more when it's taken in the context of the food matrix. So getting those minerals through whole foods rather than through a supplement, you're going to be absorbing more. So I believe that you would be best to really focus on getting good amounts of calcium through your diet, and then making sure that you're doing a lot of the other lifestyle factors that we'll talk about that can help to improve bone density, rather than just taking a massive dose of calcium and hoping that that improves your bone density, which, as we know, is not going to improve your collagen. And in fact, you're often eating smaller amounts of protein when you've had bariatric surgery because you can't eat as much, and that's going to affect your collagen health as well. So lots of things to consider there.
Makes sense.
Yeah. And also, there are other factors like chronic inflammation is going to affect your bone health. So again, doing things that help to regulate inflammation. So whether that can be different foods for some people can be inflammatory, but also carrying a lot of excess weight in conjunction with metabolic dysfunction or metabolic poor health. So we know that people can be overweight or obese and still have metabolic health. And so that's going to differently affect your hormone regulation and that type of thing and your bone health. But if you don't have that metabolic health, meaning that you're in that sort of scenario of having metabolic syndrome, which means your blood sugars may be rising or the insulin resistance in the background, but also that your waist circumference is above 80 to 88 centimetres for women is seen as an independent cardiovascular risk factor. Although that may be argued again in the presence of low insulin and low blood sugars, that mightn't be so much the fact. Blood pressure, if you still have high blood pressure and those types of things that are contributing to metabolic syndrome, then you're going to have higher levels of inflammation and that is going to affect your bone health. So another really great reason to be low carb and keto to get those things under control. And also, of course, the vegetable oils is a really big one. And I shared an article recently, actually, in one of my Facebook groups that showed a study, again, recently, was linking linoleic acid with inflammation. And linoleic acid is, what's found in vegetable oils, and it's also abundant in things like factory farmed chickens and pork, pigs that have fed a lot of corn and grains and things that they shouldn't be fed. Those types of proteins can be inflammatory. So a lot of people are just eating a lot of chicken, and some people have to do that for different dietary reasons. But if they're also eating the cheapest cuts of chicken, chicken can be super cheap, but those super cheap versions of it can be inflammatory as well for people in particular who already have a lot of inflammation. And for women with lipedema, for example, who already have issues with their fat cells, those types of vegetable oils can change cell signaling at the adipocyte or the fat cell level. So it's going to be particularly problematic for people who are already having problems with their fat cells. So I think that's something else to consider as well. Yes.
I think I read something or heard somebody maybe it was Amber O'Hearn who was talking about the difference between eating the meat of animals with one stomach as opposed to two, that there's something about ruminants and the way, even when they're grain fed, that end result when we're eating it doesn't have the same impact as animals who have the different digestive system. So, this whole having to have grass fed, because obviously there's, for most people, the problem with that is the biggest factor is cost. And I can remember coming to the conclusion that it's more important, if you can, to spend that money on things like pork and chicken, and it's less important from an end result dietary wise for you with ruminants.
Yes.
And I've noticed that I got this great, my brother, for a moving inbox, how great is this, sent me this, it was a mystery meat box. I would get a package every month from one of these companies that's all free range and organic and all the rest of it. So it's fantastic meat. And I noticed a huge difference with flavour, but with satiation and I can remember somebody talking about this in my Facebook group, the difference with satiation levels from organic free range chicken as opposed to the kind of chicken you're talking about, the cheap stuff that you buy in the super. I could eat a massive pile of wings of the supermarket wings, whereas the wings I got from this mystery box,
yes, not so much,
half as much, if that. Very, very different. So it would make sense the impact it has on your body as well. But I do remember reading about this difference between ruminants and not.
Yeah, so it's something, if budget permits, it's something to focus on. And I think you're still going to get a lot of health benefits of cutting the majority of vegetable oils out of your diet from eating fried foods and those sorts of things. And if you can't afford to get chicken that's, if you can only afford supermarket chicken, then you're still going to get great health benefits from making those changes. And I like to point that out because a lot of people hear that and think, oh, great, okay, I might as well give up. I can't afford to buy,
exactly.
really expensive chicken. And so, but that's okay. But for people who can work that into their budget,
worth it.
And particularly for people who are still having symptoms of joint pain or, other sort of inflammatory, maybe their CRPs and their pathology testing or blood test results in inflammation are showing as high, that they're things that you could possibly focus in on to help to reduce those levels. Because the thing with osteoporosis too is it is a multifactorial disease, and we're kind of really led to think of it as this very simplistic approach that if you're low in calcium, that you'll get osteoporosis. But we really have to start thinking about it as a multifactorial disease with a multidisciplinary approach to protecting ourselves from it, or to perhaps trying to, to heal or to reverse, perhaps in some instances, what we can. So, there are lots of things that contribute to osteoporosis. There are genetics. People have different, genetics and epigenetics, and what lifestyle is switching on and off with your genetics. There are intrinsic and exogenous things that influence it, meaning things that come from our lifestyles and those things around us, and also things that our own body produces inside of us. One example of that, of course, of that intrinsic or in-body things is estrogen deficiency and menopause. We've already spoken about how that can really affect that. But, as far as lifestyle factors, the reduced calcium intake can still affect bone health if you're not getting enough calcium through your diet, because again, we were saying that will tell the parathyroid hormone to start releasing some calcium from your bones. So we don't want that demineralization of our bones either. So we still do need to take that into account. But also things like low vitamin K. Vitamin K shows more that it's something that works synergistically with calcium and helps calcium to get to the bones, rather than the soft tissues like the arteries, and also to avoid it going to the joints. Magnesium intake can affect that, as well as vitamin D deficiency. So you'll find in that calcium, vitamin K2, magnesium and vitamin D really all have a synergistic relationship as far as calcium is concerned. And then, weight-bearing exercise. One of the things that happens with menopause is that women do start to decline the levels that they're exercising. So that can be problematic as well. Or they just haven't been exercising to begin with, and they're not building up that resilience, that bone strength. So that's...
But it's the type of exercise, isn't it? That's what's, it's so high on my to-do list, and it's not something that I do enough of, and that's strength. Training type exercise.
The best laid plans, I would have my arm weights sitting around, because I've really noticed the difference in, even weight gain on my arms since chemically induced menopause. And actually just finding it harder too, that I really have to force myself to exercise more, whereas it used to come a lot more easily to me. And so I used to have my arm weights sitting on the floor, kind of tucked under the table, but there in the room to try to remind me to do them. And I still wasn't getting there. Whereas I moved the weights up onto the table and left them sitting in the corner of the table, and just having them there at the height where I could just pick them up, do a few reps and put them back down, made it really easy to say, okay, if I just do 10 or 12 of these now and do another 10 or 12 of them later, and maybe once more, it only takes a couple of minutes, and suddenly you're doing 3 reps of something a day. And when we talk about that, we do just have to emphasize that if you already have osteoporosis, please do speak to someone like an exercise physiologist who is qualified medically to help you work out what exercise is safe for you to do if you have really fragile bones, particularly fragile wrists. And so don't just pick up a set of weights. Don't
just go straight into trying to do press ups and stuff.
Exactly. So you need to do that. But also impaired immune cell function can impact osteoporosis. There are just so many different things. Poor gut health. If you don't have good gut health or good microbiome, the microbiome or gut microbes are linked in with bone health as well. There are so many different factors that are affecting it. Your ability to absorb nutrients. If your thyroid health isn't well managed, if you've lost a lot of weight and you haven't had your thyroid rechecked and your medication may need to be adjusted because that's weight sort of dependent. You know, carrying excess weight, alcohol consumption will impact your bone health. So if you're drinking more than a couple of drinks a day, that can be impacting your bone health. Cigarette smoking, of course, impacts just about everything, including bone health. Actually, Dr. Ken Berry has done a couple of great YouTube clips on bone health, found some research papers linking low sodium diets to loss of bone mass. And yeah, so I've linked that in the notes as well for his YouTube clip. But, you know, again, low sodium we link to so many things for poor health outcomes. And, you know, considering that, you know, 1 in 4, 1 in 5 people are salt sensitive, the rest of us really need to be making sure we're getting enough sodium, particularly for women on keto, because I speak to so many people who aren't doing anything additionally to manage their electrolytes. They're just, you know, salting their food. And to some people, salting their food well means that they're putting a little bit of salt on their eggs, you know, as opposed to really, you know, salting things really well and taking some extra salt in addition to it. So, you know, really 3,000 milligrams of sodium, which is the minimum that you should be getting when you're in ketosis. It's important to do that because if you're getting a low sodium diet whilst you're keto, you're going to put your body into a stress response where your kidneys then have to start retaining sodium. You know, naturally they'll be excreting sodium on a keto diet. They're going to start retaining sodium, and they will do that at the expense of potassium, another important electrolyte that people often aren't getting enough of through their diets anyway. And if you're then excreting potassium, that's where things like constipation can come into it. But, you know, potassium is important for all sorts of things. All of our cells need potassium, so you want to maintain that balance. Of course, anyone looking at potassium, if you're on diuretics or something that affects your potassium, you really need to be speaking with a health professional, you know, doing keto in particular.
Yes, that's the one, isn't it? When people talk about electrolytes, you know, sodium, magnesium, then potassium at the end there is the one that you kind of have to be a little, you know, a lot more careful with. You know, I always say that the ideal is to get potassium through your diet, isn't it? Rather than be looking at supplementation.
You should, yes.
But I know with sodium is so key. I know, you know, Megan Ramos from the fasting method talks about it as this, you know, it's the foundation. It's the main trunk of the tree. Mm-hmm. You really need to get sodium right. If you've got sodium right, then everything else is more likely to fall into place.
Absolutely. Yeah. And particularly given that it does, you know, affect our stress response so much. And women, you know, so many women that I see in clinic have chronic stress. You know, it's become such a thing where you just always have this overstimulation of all of our stress hormones and cortisol. And yeah, it's something to really keep in mind, that you don't want to be adding on to that stress response because you're not managing your electrolytes well with keto. And particularly given that extra added incentive that you will be protecting your bones more if you get that side of things right. So
yes, you're right. It's just, you know, this whole bone discussion is not something that comes up enough.
Yeah.
In the right, you know, it just comes up in this very narrow window.
Yes.
You know, loss of bone density post-menopausal, and it's just this very, and Dexa scans, it's this very narrow window of discussion. But
yeah, it really is. It deserves a much bigger discussion because it is such a major issue in our...
So important. I mean, it's one of the most important things for linking to deterioration and death in old age.
Yes.
Is having a fall and breaking bones.
Yes.
You know, it's not a direct, immediate, but it's the ripple effect it has. It's one of the indications, isn't it?
It really is,
yeah. I remember reading about, you know, balance and grip strength are key indicators of health into old age.
Yes.
And living a good long life. It's very, very important.
Yeah, absolutely. And, you know, and studies do show that you do shorten your lifespan with poor bone health, particularly once you have a fracture. that, we all hear of a lot of the elderly who break their hip and never come home from hospital, and it really does affect quality of life and shortening of life. So it is something that we really do all come across at some point. And our peak bone health really happens in our 20s, through to our late 20s. And into our 30s, we're kind of living throughout that time of peak bone health. But once you enter your 40s, you're really starting then to decline. Your bone formation actually starts to decline, and after 50s, when bone loss is greater than bone formation. So it's really from there, or really ideally in your 40s, sort of leading up to that, you want to be doing as much as you can to building that strength up. And also even just looking at things like how we absorb calcium, making sure that we do have good levels of vitamin D. And we've spoken about vitamin D before in the Bitesize Nutrition podcast, because that is just so important, and a lot of women don't know the status of their vitamin D. A lot of doctors aren't asking to test that. So again, that's where I think you need to be your own health advocate to learn up why you need to be checking your vitamin D levels, and particularly if someone's talking to you about calcium, that you want to know what your vitamin D levels are to make sure you're absorbing those nutrients well. And vitamin D is so important in your immune system and other things.
Yes, why isn't it a standard annual test? This drives me nuts. Mini aside rant here, but especially now, in the context of COVID, absolutely proven that vitamin D has a beneficial preventative and in treatment. It has benefit. So why aren't all governments pushing this? Why aren't they testing vitamin D? Why aren't they encouraging supplementation if it's required, and how you can, better improve it through your diet, how you need to get more sunshine, all these things.
Yes.
Why isn't this, if you can, not going to debate about vaccines, but if you can roll out a mass vaccination program, why can you not roll out a mass vitamin D supplementation program? Because it seems like an absolute win-win. As you just mentioned, vitamin D is crucial for so many things, but why isn't this standard? Why don't we all know? A lot of us know what our blood sugar levels are, or different things that are tested more regularly. We know that. We should know what our vitamin D levels are.
Yes.
And whether we need to be supplementing, or whether the amount of sunshine and things we get is enough to keep them at a good level. We should know these things.
Yeah.
Should be standard.
Yeah, and there could be, a standard questionnaire that even goes through to say, are you outdoors very often? Are you overweight? Because we know overweight people often have low vitamin D levels. But the fact with women that does affect our bone health so much, we know that women with breast cancer often have really low levels of vitamin D. It affects so much for women's health. That, but really that's the beauty of these podcasts and getting information out there, is to encourage women to be their own health advocates in those areas, and to know the importance of some of those things that other people aren't necessarily looking out for us. Yes, so we've spoken about calcium being absorbed. Other things that can inhibit calcium absorption, because as we're saying, it really is important, getting it right through the diet is such a great way, and we'll go through in a minute just how you can make sure that you're getting good amounts through the diet. But I just wanted to emphasize, other things that can inhibit calcium absorption, which are things like oxalates. And I find this really interesting because you'll see a lot of nutritionists loading up their bowls of green veg. I saw pictures the other day of someone just absolutely loading it up with these green vegetables and spinach and things like that, because green veggies are so good for you, but they're also really high in oxalates, which are microscopic crystals in foods that are really there to deter animals from eating plant foods. So it's their own sort of protection mechanism, but in people they can be problematic. Some people can actually develop kidney stones from eating foods high in oxalates. We can also produce oxalates ourselves, and there are different precursors to that, like high dosing vitamin C can actually be a precursor to us producing oxalates. But oxalate consumption, whether it's problematic as far as kidney stones or, depositing some people with joint pain and even for women having vulvar pain can be associated with high oxalates. But it also, most worryingly, as far as this topic goes, is that oxalates bind to calcium. So you're going to really limit how much calcium you can absorb if you're loading your meals with things like silver beet or, Swiss chard or spinach. Almonds is a big thing that people, who love to use almond flour and eating almond flour every day, you're going to be, they're really high in oxalates. You're potentially going to be inhibiting your calcium absorption with that. So that's going to be, I think, a big thing to have a look at and to reassess when you're having perhaps your highest calcium intake of foods and what you're pairing them with.
Combination.
Yeah. So it might be that you're, if you're wanting to have spinach, then have it with something that isn't where you're typically getting your calcium foods from. So, and not having... keeping it separate. Other things to consider are things like zinc and magnesium and iron can inhibit calcium absorption. So you don't necessarily want to be putting dairy and iron together at every meal. So for example, when you're having your red meat, particularly if you have low iron levels or, vice versa with calcium levels, there are things like that to consider, that you're not always pairing those foods together at the same time. Low stomach acid is a big thing for calcium absorption. Lots of people, if they're taking antacids or proton pump inhibitors like Nexium, things that are changing it's there to stop the stomach acid, but you need the stomach acid to absorb things. So things like that is something to really look into, and you can't just...
That's another thing, actually, that's tied to weight loss surgery. I was put on PPIs post gastric sleeve.
Yes.
And I was told by the bariatric surgeon to take them for life.
Mm-hmm.
And it was, you know what I'm like, rebel tendency, questioner. I started reading up about long-term PPI use and was like, no, I do not want to be doing this.
No.
And so I went and I spoke to my GP about it, and he agreed with me. And that's another, I think most medications actually, but definitely antidepressants, but PPIs as well. Apparently, it helped with my reading. It's important to taper them off, and so with his help, he prescribed different ones that tapered me off.
Yes,
and I stopped taking them. It's like, no, I do not want to be on these for life. Thank you very much. But that was the standard treatment.
It's standard treatment, exactly, because the surgery it causes reflux in a lot of people. You're not able to process your things. There's a lot of acid reflux. We also know that people going on keto lifestyles actually reduce reflux, is one of the first things to resolve as well. So change of diet can be helpful for that. But you're right, it is important that people don't just take themselves off that type of medication. Like with any medication,
it's the kind of medication that the takeaway that I got from reading about it was that, well, I guess this is the case with all medication, is that if you need it, it's very helpful. And it is probable that there's a period of time post that kind of surgery where it's important that you do take it. But it's definitely a case of less is more.
Yes, because those medications aren't designed for long-term use. No. They are designed for short-term use, so they do have a purpose. But yes, you need to...
But that's how they're being prescribed. It's scary.
Yeah, yes. And it can cause rebound reflux if you do come off them quickly. So you really do need to work with your doctor to do that. So beta blockers are the same. They can also inhibit calcium absorption. So that's something else to consider as well. So as far as the risks of calcium supplementation are concerned, there are things like, gastrointestinal disturbances are quite common for people taking calcium supplements. So if you notice that you have a lot of that sort of thing, you could try a different one or try increasing your dietary calcium. Also heart disease, and we spoke about earlier that if you're taking, calcium supplementation, that it can potentially be increasing the calcification in your arteries, so increasing your risk of heart disease.
Exactly where you don't want it.
Yeah, so you really need to monitor that, and I would actually encourage people who have been doing calcium supplementation to perhaps do some of that risk assessment as far as, perhaps having a CT calcium score or a CAC score that we know it as, to have, not that that's 100% guarantee that you don't have calcification in the arteries, but it can show what calcification is there, and you can at least monitor it and see whether you're adding to that, and then you can at least do some risk assessment if your doctor wants you to stay on calcium supplements. Also, we talked about making sure that you're not having more than 500 milligrams at a time, and if you're taking vitamin K2, make sure it's in the form of an MK7. Again, you want to perhaps seek some advice about, good ratios of those types of things. Typically you want to look at, 100 milligrams of K2 for every 1,000 milligrams of calcium, but of course you don't want to take 1,000 all at once. Anyway, so that can be important. There are studies that show some association between excess calcium and bowel polyps. So that might be something to look at as well, that if you're taking excess calcium in a supplement and you're not able to absorb it, is that excess then travelling through the bowel? Is it being deposited out in the joints or the arteries? Is it aggravating the bowel? And of course, kidney stones, we mentioned that as well. So just to kind of go through and talk about, ways of improving bone health that you can do, one of the major things is going to be the weight-bearing exercise. So carrying your groceries even can be a good thing. If you don't normally sort of carry your groceries, if you're using a shopping trolley or, using other things, I try to carry them as much as I can, just because you're getting that extra weight resistance. But also, incorporating some weights into your day so that it doesn't seem like a chore, similarly to how I do it, that I'm able to break it up into little portions, but I still get it done over the course of the day. And so, whether a PT or a trainer can help you, to get into a routine, because that's really the key to success with any of these things, is to make it part of your daily routine. And once you've done that, then it's kind of easy sailing. But what most people struggle with is getting something established in their daily routine. So any way that you can have someone help you to do that, I think, is really helpful.
Yes, I know Rangan Chatterjee talks about he calls them health snacks, I think, little 5-minute things that you can put into your routine. And I think he has a sort of body weight type resistance routine that's things like squats and press ups and lunges and those kind of things that put resistance on some of the big muscles. A 5-minute routine that he routinely uses while he's waiting for the kettle to boil in the morning.
Yes, exactly.
Does it in the kitchen,
Yeah, little things like that. Because a lot of the time people will say, okay, I've got to do this, and they set up this hour-long exercise routine. They go from sort of 0 to 100 and they skip those steps in between, and it makes it really unmanageable, particularly if you're unfit and haven't been doing things for a while. You have to pick the easiest version of it, I think, to start with as you can, and just get it into that routine. And then you can add to that as you go. But, if you're skipping to those other steps and it's making it difficult and then it's not sticking, I think you've got to scale that back, find a really easy way to do something, and then add on it once you're really nailing that particular thing. Obviously, limiting alcohol, caffeine can also deteriorate bone health. So, I think a lot of us just get into a bad habit with caffeine. Aside from loving it, I love my coffee, but there's a difference between having 1 or 2 a day to using it to actually get some people can't function without stimulating their adrenal glands and having to actually get into that, having adrenaline going, because otherwise they just can't get going. So that's kind of that adrenal exhaustion, and so you're needing coffee to actually get you to do your task. So one of them is addressing that chronic fatigue that's actually kind of underlying that, but the other thing is just sort of exploring other things that you can do rather than just having a coffee or tea out of habit and thinking, okay, well, a couple are enough. But if you're still drinking coffee at 10 o'clock at night, then that's going to be an issue. Reducing stress is a big one. Chronic stress is bad for pretty much everything, and finding different ways you can really mediate that is key, I think, for good health every day. You need to be actively participating in stress management every day, and it doesn't have to be anything big. That can be 5 minutes, here and there, deep breathing exercises, essential oils, any of those types of things that can really help to reduce your stress levels. Avoiding that low sodium diet.
I think, again, when it comes to stress, it's what you were saying about going from nothing to lots in one foul swoop. I think one of the mistakes that people make is feeling the need to go from being chronically stressed all the time to not being stressed, and that the underestimation of the importance of just doing little stress reduction things. So taking 3 minutes during your lunch break to do some breathing exercises. It's not all about going from being super stressed to not being stressed, but each little bit that you can reduce is going to have a huge benefit.
Yeah, absolutely. It really does.
You don't have to fix it in one foul swoop.
Yeah.
And in fact, it's almost impossible to do.
Yeah, that's right. And again, it's about starting small and just doing those small doses to begin with, and whether that's just doing some deep breathing. But also that just encourages you to become aware of how much stress you're living with. That's something that I had to really change in my life when I was diagnosed with breast cancer, is I had to really take an honest look at how I was operating, and it was often living on adrenaline. So that was something that was really beneficial, and has been still for me now, that every day I actively participate in reducing my stress levels. Other things that are really beneficial, of course, one of them is avoiding falls, which comes back to that maintaining muscle mass, because this is important as well. So making sure you're eating enough. When you hear about people who are doing OMAD with keto, 1 meal a day, if you're doing that correctly and having good amounts of calories and feasting when you are eating, may be okay. But for people who are calorie restricting and doing 1 meal a day and not getting enough protein, and not even aware of how much protein or calcium or other nutrients they're getting through their diets, then I would encourage you to use a nutrient tracker for a while to get an idea of just how much you're getting. Because if your protein intake is really low, your body's going to break down your own muscle mass if you're not getting enough through your diet. And if you don't have the muscle mass as you age, it's harder to lift your legs as higher as you walk. You're more likely to trip and fall, and those sorts of things are, can really be under our control to help, with healthy aging. And of course, we spoke about, addressing the hormones, that's really important as well. If you're going through that stage of your life, making sure that you're managing your blood sugars. Calcium, we've already spoken about. Collagen. Now you can get, collagen from eating good quality proteins, preferably not just having muscle meat. You still get collagen through that, but having all different types of, chicken, you get all of the different, and not just chicken breast, where you get all of the different parts of the chicken, the gristle and the tendons and all of that stuff that really contributes to collagen. Having bone broth can be really beneficial for that as well. Having, boiled eggs with that membrane that's around the egg is made of collagen. That can be beneficial as well. Quite often we throw that away, but that can be good. And if you can't get enough collagen through your diet, then perhaps considering a quality, collagen, hydrolyzed collagen peptides supplement that can up your protein. So for people finding it difficult to have a lot of protein, that can be something that you could look at supplementing if you're not able to get enough through your diet. Some people just can't bring themselves to have bone broth. They don't like organ meats. And, if you're not eating eggs and different parts of the chicken, if you only like chicken breast, then those people, I'd say that perhaps you're best to be supplementing with some collagen peptides. But really, that's something that you should be able to get through your diet.
Yes, and like you were saying, those slow cooked. And again, when we were talking about the cost factor, well, there are so many benefits to a lot of these cheaper, gristly cuts. They're cheaper to buy, but then slow cooked, they make that, lovely, sticky deliciousness that's also good for you, good for your bone health.
Yeah, and it is delicious. It is and providing all of those nutrients. So, ideally this is something that we can do through our diets, but the reality is, though, a lot of people can't for various reasons. They're not wanting to have, some people are very stuck in their childhood memories of foods that they did and didn't like and aren't able to break that old pattern. Sometimes it's from overeating carbs and having that being used to having everything taste sweet and easy to digest, and to chew, that suddenly, for some people do have sensory issues, so that can be difficult for them to have those other portions of meats that they do need to keep food simple, and so that can be difficult. And they're all the sorts of things you take into account to determine whether someone might be better supplementing something that they could ideally be getting through foods. So lots of things there. Vitamin B6 helps you synthesize collagen, and as we talked about, magnesium is also beneficial, and vitamin C, not too much, but you can get a lot of vitamin C through your foods, but that helps to support collagen production as well, and all of those sorts of things can help with bone health.
Yes, it's incredible the things that impact bone health. I remember being blown away by, have you read James Nestor's book? It's either Breathe or Breath. I can never remember which,
No.
but it's basically All You Should.
Okay.
It's a very good read. It's a very engaging read, and it's also fascinating. But he talks about the importance of nasal breathing. And the reason why I thought about it was that he actually studied himself, and through it was nasal breathing, also the importance of chewing, but I think it was specifically the nasal breathe. He was predominantly a mouth breather, and he trained himself to be a nose breather through mouth taping and other things. But they measured the bone in his jaw, and I can't remember the percentage it increased, but he grew bone in his jaw by switching from being a mouth breather to a nose breather.
Wow.
So that was just the breathing. And he talks about a woman, it's scoliosis, the twisted spine, breathed her spine straight.
Wow.
Read the book. I think you'll love it. So the power of breathing, the importance of how you're breathing and the difference that makes. I mean, how would you think that breathing through your nose would impact bone growth and density? I mean, but it just shows, doesn't it, how integrated all these systems are.
Yes, it really does. Yeah, fascinating. I will have a read.
And so calcium through our diet. I mean, the obvious thing is dairy, presumably. That's one of the easiest ways of getting calcium.
It is, yeah. Dairy is a great one, but also, things like fish with soft bones. So when you get, tinned salmon or sardines, I mean, you don't want to be eating tinned food a lot. Obviously, they're plastic lining and that type of thing. But sardines, mackerel, anchovies, any fish with those really delicate bones. And quite often when I talk about tinned salmon, people, often prefer tuna. But the tinned salmon, when you get it with the bones and the skin, which, the skin has collagen and different things, as well as the omega-3 fats. So that's the really good stuff. And the thought of eating bones to some people is horrific, but they're so soft. You just mix it up with a fork and they just disintegrate. They're so soft. So it's not a problem at all. And that's a really great way to be getting good amounts of calcium. So I really encourage that way of getting them. Anchovies you could be putting into things like a salsa verde with keto, which is delicious. Sometimes we're wanting to up our fats a little bit without upping our protein. If you already get plenty of protein, well, using a dressing or a sauce is a great way to do that, so that you're upping your fats, for satiety if you're finding that you're hungry. Adding anchovies into sauces can be really nice, or using it in cooking at the start of cooking where you're breaking them down so you actually don't even notice they're there.
Yes, I was going to say you can throw them in. A lot of people turn their nose up at things like anchovies. It's that concentrated fishy saltiness that a lot of people don't care for. But using it in cooking, it adds a really great umami type flavor to things, and that you don't taste.
No.
It doesn't make everything taste fishy.
No.
It just adds this depth that's really great, actually. So throwing it in, especially things like we were talking about with slow cooked, stews and things like that, throwing it in at that first stage when you're sweating off onions and things like that, it will disappear in.
It does.
But it's going to add a layer of flavor, and it's going to help your bones.
Yes.
So, win-win.
They're often stored in vegetable oil, so do watch out for that. But, nuts and green leafy vegetables contain calcium, so you can get green leafies, for example, that don't have the high oxalate levels. So, things like rocket or arugula are really great for that have lower oxalate levels. Broccoli is another good green leafy vegetable, bok choy. So you can still get those types, and some different nuts as well that we like to consume. Some people like to have nuts, some people don't. That's an individual thing of whether, for some people they can cause inflammation. But there are other things as well that do inhibit calcium. So we spoke about the obvious oxalate ones like spinach and almonds and almond meal, but also coffee and tea. So drinking a lot of coffee or tea, again, and perhaps this is one of the reasons why it's associated with poor bone health or contributing to bone loss, is because of the oxalate contents in them. So if you're having a lot of coffee and even cocoa powder and almonds and spinach, which, some people are having quite a lot of those things all in a day easily, and it can...
Real staples.
Yeah, staples that can, on the surface appear really quite healthy, but underneath could be interfering with that calcium absorption. So, focusing on those soft-boned fish, I think, is a really good way to get calcium, and then some of those other foods. And it's worth having a look at going through and seeing a list of what the calcium content is of foods. And if you do use a nutrient tracker, something like Chronometer, the beauty of those ones is that it does tell you how much calcium you're getting from the foods that you enter into it. And then you can also, if you pay for a gold version, you can also ask the Oracle and look up what calcium content are in foods. But you can do that easily enough anyway, and really just get familiar with how much you need in a day and what you'd need to be eating to be able to do that. And particularly for people who aren't including dairy. If dairy is causing inflammation, or, for a lot of people that have sinus and congestion issues with dairy. So you really, if you're not including that, you need to be having a look at where else you get your calcium from.
Yes, I often think it can be fun. It can be a fun way to just change your diet up a bit. You go and, Google which foods are high in calcium, and go down the list and find some things that, you fancy trying or you quite like that you haven't eaten for a while. And it's a good way, actually, of just, making your diet a bit more interesting by rotating some of these things in and maybe rotating some of the things out that we talked about that could interfere, and just to change things up a bit. So just from that perspective,
absolutely, because
it could be a good thing.
Yeah, it's so easy to fall into
It's
passions,
easy to just get
it?
set in your ways, isn't it? Yeah, and just eat the same thing every day because it's easy, but it might be beneficial to switch things up a little bit.
Yeah, absolutely. And, things like, vitamin K2, which is really important, you can get that through your diet as well. And so, again, people who are eating full fat dairy and things like chicken, liver, a lot of people don't eat liver, but eggs, dairy, and things like fermented vegetables can help there. So again, if you're vegetarian, you're really going to want to have a look at these different nutrients that are involved to see. You can get marine collagens, for example, but you're not going to get the same levels as you get through the meat products. So you really need to look into those things more so, particularly if you're not pescatarian. That can be particularly problematic.
Well, fascinating. That really has been very interesting. Is there anything else that I haven't mentioned that you'd like to get across before we go into the old top tip?
No, look, I think we have been fairly thorough there. I mean, there, of course, I could just keep adding onto that. And whenever I research these things, I go off onto so many tangents, and you kind of have to stop somewhere. But, so many things impact health in various ways. But I think just to be aware even of the basics, and I don't want to scare people off either of giving so much detail, because it's not too complex. It might sound overwhelming, but the more you expose yourself to that information and the more you just kind of pare it back and say, okay, well, what foods can I be including that can cover these? And just get familiar with those foods and look what you're currently taking in and where you could make some improvements. You don't have to make it all overnight. Just do it gradually and focus on one thing at a time and get that right.
Yeah, fantastic. We will put in the show notes where people can find you, but just give us a quick reminder of where people can find you.
My website is ichoosehealth.com.au, so you can head to my website and get in contact. I also have a Facebook group called Nutrition and Lifestyle for Lipedema and Lymphedema, which is a private group that you can come along to if you feel you have one of those conditions or would like to find out more about them, or even if you're a clinician, you're wanting more information on them. We have another 8-week keto nutrition for lipedema and lymphedema course starting in May. We run those every couple of months, so you can always check that out to see if when the next course is running.
Oh, good timing. Well, we'll put some links so that it's easy for people to find. Fantastic.
Thanks, Daisy.
Well, it's that time when we round off with a top tip, please.
Well, my top tip really, as far as I think bone health, dietary-wise, is really just getting variety, being open to eating new foods, having a good varied diet. Unless you're carnivore, which is different, but again, getting variety for carnivore can be great as well, and making variety in cuts of meat, so whether you're carnivore or keto and including vegetables, getting variety in anything you're eating, I think, can just be such a great way to make sure that you're getting different types of nutrients in good amounts. So that would really be my top tip, particularly when it comes down to calcium and even magnesium and vitamin K2 and there are different other minerals as well that are important for bone health. So having that variety will help you achieve that.
I think that's a key word as well, isn't it? Yes, variety of diet, but variety of things that, one, impact bone health, but the variety of things that bone health impacts. So I think it's a very a good key word to link to bones.
Yes.
Well, as promised, that's been a very, very interesting conversation. I've really enjoyed it. Thank you for bearing with me, going off on my various tangents. I've managed to extract more information on different topics from you along the way. But as always, it's been very enjoyable. Thank you very much for sharing some of your time with me.
Oh, it's a pleasure. It's thank you so much, Daisy. And it always makes it interesting. I love where your mind travels, and it makes the conversation interesting. So thank you.
Oh, that's good. That's a relief. Thank you very much, Megan.
Okay, see you.
Thank you for staying with me right to the very end. I do hope you enjoyed that. I hope you learned a few things. I hope you found it interesting as I did. I thoroughly enjoyed it. I enjoyed it when I was recording. I enjoyed listening again as I was editing. And we're at that point for the end quote. And I'm going to step away from the James Clear quotes this week and go with a quote that my very good friend Kelly sent me. And the meme she sent me was anonymous, I think, and it's one of those quotes that gets taken by people without crediting the author. And you know what I'm like. I do like to find who wrote something, if at all I possibly can. And so I don't know 100% whether this is the person who wrote it, but it looks to be the case. So this is a quote from Diana Pisari. If being hard on yourself worked, it would have worked by now. And if you're anything like me, that will have got you right in the gut and hopefully make you stop and think. If being hard on yourself worked, it would have worked by now. So, stop being hard on yourself. Please take very, very good care of you, and I will see you back here, same time, same place, next week. Bye-bye, Keto Lovelies.